Good afternoon, Namibia, and a very warm welcome to today's discussion, coming to you live from the Government Information Center here in Windhoek. I am your host, Hileni Felipe Samunyela, and I'll be keeping you company for the next 50 minutes or so. Today, we are discussing mental health awareness, and this episode seeks to define what mental health is, but also to clarify the difference between mental health and mental illness, and then finally to identify and highlight the institutions of mental health that are available at our disposal. Now, as per the usual, as per the norm, we are supposed to be bringing you the COVID-19 health update, but due to technical difficulties, we are unable to bring you the health update for today, and therefore we continue with the discussion. I'm joined in the studio by Dr. Hileni Njaba. She's a consultant psychiatrist and also head of Department of Psychiatry in the Ministry of Health and Social Services. She is going to help us unpack this very important and critical topic of discussion. Good afternoon, Doctor. Welcome to the Government Information Center.
Good afternoon, Hileni. We are both Hileni.
Yes.
We are going to storm the show today.
Indeed, we will.
Thank you.
All right. Now, Doctor, the issue of mental health is one very complex, if I can put it that way, but it's also very critical because it affects us as human beings in one way or another. In your opinion, or as an expert, how would you define mental health? And what are some of the risk factors that could lead to the breakdown of one's mental health?
Thank you very much, and good afternoon to the nation. Good afternoon, Namibia. I think I want to appreciate the time that is given unto me to speak about mental health and to bring to your attention about mental health awareness. First and foremost, I would want to appreciate our government, especially of recent announcement by the Minister for Health and Social Services that their strategy and attention of nowadays and in future will be more focused on mental health, which I really felt as a mental health advocate has been neglected. And now that the nation is paying more attention to mental health, I appreciated it very much. When we talk about mental health, whether the public or the professional, not everybody understands mental health. The moment you speak of mental health, the mind of a person is already talking about mental disorder. But mental health is different from a mental disorder or a mental condition. All of us Namibians and across the border, we need to be mentally healthy. Mental health is defined as a state of well-being of individual so that they be able to cope with the stress that they are encountering on their daily life, so that they be able to be productive and fruitful and to contribute to the whatever have to happen in their surroundings. And when we talk about a mental disorder, there are two terms that are used. You can either use a mental disorder or a mental problem. What is the difference between the mental disorder and the mental problem is just the magnitude. The one that present with obvious symptoms, which we will discuss later, that person has developed a mental disorder. And the other one that have developed a problem, which they are not really defining it, and they are not understanding to an extent, that is a mental health problem. So therefore, as we are talking about how do one identify that they have got a mental condition. First of all, I really want to bring it to the understanding that mental health disorders is one of the things that people do really not want to accept due to stigma and discrimination. So therefore, the symptoms are also not well understood by the public. They rather understand it in a different way. And when somebody develops a mental condition, they don't see it as a mental health problem that can be taken care like any other physical condition. What happened is that I like making comparisons for the people to understand because normally we want to know what is causing the mental condition or disorder and how can one take care of that mental condition. And the people also, maybe I want to bring to the attention of the nation is that they feel that there are a group of people out there who are the only one that should suffer or have to suffer from a mental health condition. So the mental health condition can affect any one of us, regardless of who you are, whether your gender, your age, your religious, your political, or whatever your involvement in the society. So, and what happened of nowadays, we are really seeing people with mental condition being discriminated, being stigmatized, and we really want now today as an opportunity to bring at least, let me say, what is that causes it? And how does one present with a mental condition? Because by understanding what is the cause, then after the person have developed the mental condition, how does that person present like? Okay, let's start with the causes. If I have to ask the public right now to say what do they think could be the cause of mental illness, majority of them, which I have done it and I can testify to it, is that they will tell you so have developed a mental condition because they were witched. It's by witchcraft. Then you hear another one say that so have developed a mental condition because of demon, spiritual. Those are what the people believe. Those we call them myths. And those are not really the reality of causing of mental condition. So what causes mental condition, which there are of many types, different types of mental condition. But when you talk of mental condition or mental disorder, people only talk about, I'm not crazy, I'm not mad. But we are not referring to those ones. There are many of them, more than maybe even 50 conditions or more. So we will more talk about the obvious one and perhaps the causes of the obvious one. As I said, the causes, if you look at the literature review, according to the book that the research has done, there are some incidents where the cause of that person to develop a mental condition is not known. But there are other factors that are well known to contribute to mental illness. First of all, when you look at it, we are saying there are those which are predisposition. The person is predisposed and is likely to develop a mental condition, like in case of genetics. If this person is born in the family where there is somebody with a mental condition, this person is likely to develop a mental condition. And it's not necessarily that it's caused by witchcraft or by demons. Then the other one is precipitating. This person may then have the genetic, but not necessarily that should develop a mental condition, but there are things that can precipitate this person to develop a mental condition. Then there is others that perpetuate. So there are other conditions also or things that can now make this person develop the mental condition. And luckily enough, they are also preventative. That even if a person has predisposed to genetic, that they are likely to develop a mental condition, but because there are preventative measures, this person is likely not to develop a mental condition. Then within those 4 Ps I have talked about, each one has got an underlying, like I said, they could be genetic, they could be psychological, they could be environmental, and they could be social. And the psychological is that somebody can be exposed to a traumatic life event where they are failing to cope. Then as a result, they may then develop a mental condition. And in case of social, we know that we are talking about unemployment, poverty, psychosocial problems. We have got gender
gender-based
violence. We have got bullying. We have got all sorts of things. And even physical illness can lead to somebody to develop a mental condition. And vice versa also, somebody with a physical condition may also end up developing a mental condition. So there are so many of them, depending on the type of a mental condition the person is presenting with. I know you talked about how do I know that I have a mental condition. After now this person has been either exposed or have come across to something that made him or her to develop a mental condition, most of the symptoms, although this condition, they present differently, but I will more touching on a general, that if then you develop a mental condition, one may start feeling sadness or complaining of being down. One may feel like want to be isolated, not having friends. Then one may start having paranoia, persecutory, those are delusions, feeling that somebody want to do harm to them, somebody want to poison them, somebody is following them, and somebody doesn't like them. And sometimes also the mental condition, depending on which one, can also affect our 5 senses. The 5 senses which are seeing, hearing, feeling and touching, tasting, and also in general, what do we mean that is when now this person develops hallucinations. So the hallucination is there where now somebody may start hearing voices, but in actual fact, there is no voices. It's only because this person has got the disturbances. Then the person may see things that it's only that person is seeing those things. The person may feel something crawling on their skin, but in actuality there is nothing. And the person may taste maybe even water or juice or anything, but it's not tasting the taste of that particular product. It is something else. Then they may smell. As we sit here, somebody say, I'm smelling as if there's a tire burning or and so on. It means that this person has got disturbances in their mental capacity.
Wow. Okay, doctor. That was quite a mouthful. All right. Now, as a psychiatrist consultant, doctor, what is the mandate of your institution in relation to mental health?
Okay, we are operating under the mandate for Ministry of Health and Social Services, which is for stand for the development and also for coordination for policies, strategic planning, and also for program funding, specifically for mental health, and also in support for training, and also coming up with strategies for mental health registrative.
Okay. All right. That is fair enough. And now, May is globally observed as a mental health month. And based on your monitoring and evaluation standards, how effective were the campaigns that were run by both the ministry and perhaps that of your of the practices around here or institutions around Namibia?
Okay, what happened in May, we maybe because of a lot at hand and mental health and the COVID at the same time, I'm aware of, I think, a specific issue that was looked into when it comes to mental health. They were more looking at bipolar, and that was more talked around the month of May. And during this May 2020, we did not have specific program that we were running, apart from on daily basis that we are carrying out awareness of mental health, where we encourage that people should seek help when they identify that something is not right with them. And sometimes it really becomes a bit of a challenge because the one who is mentally sick, they may not really find that they have got a problem, but the people who are closer to them, they may identify that they have a problem and they need help, and sometimes they don't take that advice from the people who are closer to them and have identified that they have got a problem.
All right, now Namibia, there you have it, Doctor. We are conversating in the studio, and as you may know, this is a national conversation. We are encouraging you, our viewers and listeners, to come through with your contributions, make your sentiments and views heard. On Facebook, we are at Ministry of Information, Communications and Technology, Republic of Namibia, or you can also stream us live on our YouTube. Our handle there is MICT Namibia. Alternatively, you can call us in the studio. The call-in number is 061 400 397. The call-in number is 061 400 397. Now, Doctor, as we await for our viewers and listeners' views and sentiments and contribution, let's continue with the conversation. Mental health in itself, as I said earlier, it's a complex one. What are the prevalent health issues that you have encountered on the ground as a doctor? And how would you identify these mental health conditions? I know you've briefly touched on them, but maybe if you can just speak to what this question is asking.
Okay, what is happening is that as we are running our mental health institution, which is part of the Windhoek Central Hospital, and currently mental health is also not done countrywide, as per district or nationwide, because what happened is that not each and every professional, health professional, including the doctors, that has got the knowledge on mental health. And the government have tried by all means to see if the mental health services can be decentralized so that it can be lended to all the district hospital and the regional hospital. But currently, as we speak, mental health services is more available at Ward 16. The services now is available at Ward 16 at Oshakati and Windhoek Central Hospital Mental Health Care Center. The problem as we are seeing them of mental health is that we group them according to the number of the patient we are mostly seeing, because this is not a research-based, but this is more of a database, depending on the number of patients that come to us, and we group them according to what condition we see more. Like for instance, from January 2022 to June now, our highest mental health condition or mental disorder that we have seen so far, if we have to rank them from maybe 1 to 5 or 1 to 10, is that people with schizophrenia are more, followed by people presenting with mood disorder. When we talk of mood disorder, we are including depression and bipolar. Then apart from that, then the third we can rank it is schizoaffective. These are medical terms. Schizoaffective is somebody who has got either having a mood disorder and also a psychotic disorder. And then the other one is substance use disorder. In fact, substance use disorder, if you look into it, it is almost competing with schizophrenia, because you find out that substance is more, patient whom we are seeing, they are almost, many of them are using substances. Whether now the substances was the one that induces the mental condition, or the person used the substances as a coping or a treating mechanism, substances use become now a problem. But we are not surprised, because if you go to substances, the country is really suffering because of the use of substances. Then the other condition that we are having on the ground is that we have got ADHD. That is attention hyperactive, mostly common in children, although we have few adults. Then we also have suicidal ideation or parasuicide. Of course, the suicide one, those who have attempted, we don't see them, because those, they go to the mortuary. Then we also have got PTSD, post-traumatic stress disorder. The post-traumatic stress disorder is very common among our ex-combatants, and it's also common among women and the children and adolescents, due to gender-based violence and other things. And we also have epilepsy, that is also very common on the ground when it comes to mental health. Although epilepsy is really not a mental health condition, but because when somebody with epilepsy get epileptic attack, they develop post-ictal, they become confused. So now it's become a challenge, because they are not too sure whether now the confusion is to be contained, where this person is supposed to be treated for his epileptic, or should this person then refer to a mental health institution. So as a result, as the professional working at mental health, we tend to take care of everything. If somebody goes for treatment to a doctor, especially those who have got other conditions like conversion disorder or somatic disorder, they will look for anything. They do laboratory investigation, they don't find anything. Mental health become the last sort. They will refer the person to us, and we do take care of them.
All right. Now, doctor, as you rightfully said from the beginning, you know, no one is spared from this mental health. In fact, it affects all of us, if not everyone, indirectly or directly. I'd like to know, especially in children that are not expressive of themselves, what are some of these early signs to look out for, and for one to know that their state of mind is actually not healthy for a child who cannot express themselves?
What happened with the children is that, in fact, even they do suffer from things like depression, and they also suffer from schizophrenia, but not so early age. And I have also talked about the ADHD. They also suffer from autism. They also suffer from intellectual disability. They also suffer from oppositional defiant disorder, conduct disorder. They can also have aneurysm, encoparesis, and the many conditions that they have, and even eating disorder. Depending on how they are presenting, sometimes it becomes difficult, because the parents or the caregiver, they may not understand this child as to pick up what is the problem. And the child, they can also not express themselves to say what really their problem is. But when you see your child becoming isolating, and they complain, perhaps not sleeping, and they become irritable, they become listless, and they also are tearful for no reason. And if they are school going, their school work has dropped. And those who are perhaps they are being neglected, like we have got parents who have to leave their children in the care of their caretakers. They have a way to, when you talk to them, they either want to close their ears because they don't want to hear a noise because they have been hearing this noise from the caretakers. And sometimes they also start wet bedding, bedwetting, because yes. They have stopped bedwetting when they are kids, but of late they start bedwetting. And those are some of the signs that we must watch out for.
Okay, Doctor. Now, Namibia, as earlier alluded to, it is a national conversation. We are urging you, our viewers and listeners, to take part in this very important conversation. You can also catch us live on Facebook. On Facebook, we are at Ministry of Information, Communications Technology, Republic of Namibia. Or you can also stream us live on YouTube. Our YouTube handle is MICT Namibia. Alternatively, you can call us in the studio, and the call-in number is 061 400 397. The call-in number is 061 400 397. We have a comment on our social media platform. All right, Richie Third Type says, how do you persuade one to go to rehab? Doctor, he would like to know.
Yeah. In fact, what happened is that for one to go to rehab, one must first of all accept that they have a problem and they are looking for solution to that problem. But the mistake that we are doing is we are forcing someone to go to rehab when they have no insight to what is their problem. When you see somebody coming and that particular individual, the affected person, is the one who is telling you that I want to go to rehab, that is the person who is ready. But the one who is not ready is not that we are going to leave that person and wait for them to be ready, because at one time in life they will never become ready. So what we normally do, we do motivational to them, to motivate them by at least educating them, explaining the benefits that they will gain when they go to the rehab, and also explaining to the negative impacts that they will experience if they don't go to rehab. It is very, very difficult because if the person does not have insight, they don't see it as a reason for them to go to rehab. For example, mostly the rehab we have is more of specifically for those who are into substance abuse. What happens is that they will tell you, I know I'm using substances, I'm drinking alcohol, I'm smoking cannabis, I'm using cocaine or whatever nature of the substances, but that is not a problem. But now they have developed behavior problems, and they may even have developed mood problem, they may even have developed psychotic problem, but then we say, okay, for you to be able to become a normal person again, we want you to make sure that you are on treatment, medication, you receive psychotherapy, and also you go for your substance rehabilitation so that at least you stop using the substances and you gain your normal self. But because they have this lack of insight that the substance is not a problem, they will definitely refuse to go to the rehab. Those families out there, if you have your relative or yourself that you find yourself into substances, you really need help, because substances, as I was explaining, the causes of mental illness. Nowadays, it's even one of the highest cause of mental illness. So therefore, please encourage your loved ones, your colleagues, to go for rehab. It will help them.
All right. Now, okay, doctor, we have another question from our it's our YouTube channel, MV Reloaded. He's saying, looking at the gender dynamics, is there a psychological explanation as to why more men commit suicide than women?
The reason why more men commit suicide than women is that women, they are outspoken. Women speak about their problems. Men do not do so, because if they speak, they think, in fact, even people, the society even demoralize them, that you like talking like a woman. So you rather keep quiet, even if you have got a problem, you have nobody to share with, and as a result, you do not get any help or advice, so you end up completing the suicide. And the other reason is that when a man wants to commit suicide, the men more use the Rethic method, where they have access to guns, to any other weapons, and they can really end up killing themselves. Women, sometimes they speak of suicide because they want to be loved, and they are seeking attention to be loved. That's why whatever method they're using for committing suicide is not a method that can kill them easily. And also, women do speak out.
All right. Doctor, you've just alluded to the fact that when women speak of suicidal statements, you know, they would say that seeking for attention from either men or whosoever they are seeking it from. Isn't that psychological abuse that they are doing then to their psychological manipulation that they are doing to their loved ones?
No, it is maybe one can say yes, partly psychological, but partly not. As I stated that we look at that a woman wants to be loved, a woman wants to be appreciated. So therefore, as a result, they may use it as one may think is a manipulation, but they are seeking that love, that understanding, that support that they want from either their parents or their partners or their husband, which they are not getting. But as it accumulates, they may then end up really get into depression. Then one of the symptoms of depression is them becoming suicidal, and as a result, they may also then end up committing suicide.
Mm-hmm. All right. Now, doctor, you know, in our society, especially whilst growing up, you know, a boy child was told, "Don't cry, you men don't cry like that," and a girl child it's as if the girl child is allowed to cry and express her emotions as opposed to that of the boy child. Could this be then why the boy child is silent as an adult and bottling up things as opposed to being expressive?
Yeah, as I have said before, depending on our upbringing, our cultural values and norms, it is really correct, as you have stated, that a boy child is told not to cry, and as a result, the person who even asked that question, so why more men are committing suicide than female, or is the result that we are saying a boy child do not speak up. They bottle up whatever they are going through, and sometimes also they see whatever they are going through is part and a part of their life to become masculinic, and but psychologically, emotionally, it is draining them, and they then at one point in time find themselves not able to cope, and as a result, they may then end up either, in fact, engaging themselves into the use of substances. Because if we look at statistic or literature review, it is more men that are using substances compared to women, especially nowadays. And we need to do some research to find out mostly the reasons, so that we speak with confidence to say, okay, more men are using substances because of the problem they are facing in the community, in their society, because they are told not to cry. They are also told not to talk about even their finances, but women are so free that among themselves they talk about their finances, they talk about their relationship with their partners, they talk about what they got from their partners. Maybe somebody bought them a cell phone, or somebody. So the women are more receiving of material and love when you look at compared to men. Men only receive something maybe on Valentine's Day or on their birthday or on few occasions. But when you look at women, there are so many things that are happening to them. They will be taken for outing. They'll be celebrating the birthday. They will be celebrating many, many things, or somebody just show up and they bring a woman a flower or something, but not so much is happening to men. So I think they are more deprived of other life, to say.
All right. Now, Doctor, as you've rightfully said, and as we know, the society has made it a norm for a boy child to compress their feelings. How do we then help, how do we rectify what has been done to ensure that the boy child then grows up to be an expressive person, so that they don't bottle up emotions and end up using substances and so forth?
I think we have to look into parentalhood. How are we upbringing our children? So we need to treat the children equally. So we need to understand the children's emotions, not just to say a boy child shouldn't cry and so on and so on. So whatever is happening at home, as parents, everything must start at home. As parents, we should treat the boy child and the girl child equally, and not to say this one you shouldn't do that, you shouldn't do that, because nowadays, even when you look at people who are competing for a job, everybody wants a job now, whether that job specifically was only meant for men. Women are into constructions, women are into looking into high positions, and if we look at our political nowadays, people are talking of zebra, so that equal representatives. So therefore, we really want to be able to see to it that the boy child should be treated equally like that of a girl child, so that when they grow up, no one really feel that this expression should only belong to this one, and this one should also only belong to that one. And also the boy child must start speaking, must start talking, must start identifying. And that's why even I think when we are talking about women and child, I think that need to be changed to gender or something, so that every person will be involved. Because, for instance, women can complain about being battered by a husband or by a boyfriend, but when a man go and complain about being beaten up by a girlfriend or a wife, it's like a laughing stock. How is that possible? How is that, can it happen? That's why now, for them to proven that they cannot be beaten, they become now the perpetrators of violence when it comes to women and children.
Indeed. Again, Namibia, we are inviting you to take part in this national conversation. It's a topic that concerns all of us, if not most of us. We are on Facebook at Ministry of Information, Communications Technology, Republic of Namibia, or you can stream us live on our YouTube channel. Our handle there is MICT Namibia. Alternatively, you can call us in the studio. Our calling number is 061 397 400. Sorry, the calling number is 061 400 397. The calling number is 061 400 397. Okay, we have another comment from our social media platform. MB Reloaded is asking, is bipolar a mental disorder inherited from birth, or is it caused by social constraints?
Okay, this is what I'm saying. When I was talking about the mental conditions, I talked about schizophrenia, I've talked about bipolar mood disorder, I've talked about depression, there is anxiety, there is personality, there is substance use disorder, and we have also talked about the causes, and mostly we look at the genetic component. When we talk about the genetic component, I would like making explanations so that people can understand. For instance, if somebody looked at me who perhaps know my parents, without knowing my name, they would definitely say, you are a daughter of so-so. What makes them referring to say that I'm daughter of so-so is because either my eyes, either my nose, either my facial appearance is looking like that of my parents. So therefore, bipolar as one of the mental condition, it is not different from any other condition I have just mentioned, like schizophrenia. So bipolar disorder can also be inherited. It can be genetical. What happens is that you can have siblings, brothers and sisters, born by the parents who perhaps they suffer from bipolar mood disorder, and it's not necessarily that each and every child from that family will suffer from bipolar. What happens is that we are looking at, as the caller or the person who made a request, is that whether it's a social constraint, it's caused by a social constraint. What happens is that, as I stated, it can be genetic. You can have it, and it's lying dormant. There's no active or symptoms of bipolar. But then, when you come and expose yourself to some maybe socio-economic factors or environmental factors, then you tend now to develop bipolar. For instance, you start using substances, you may likely to develop bipolar, or perhaps you have gone through a stressful life event that can also contribute, but it's not that you have no genetic component and suddenly you develop a bipolar.
All right. Okay, doctor, anger issues always seems to be one of the side effects of mental illness. And how do we then advise individuals or family members to deal with, who are dealing with this, to get effective long-term treatment? I know Dr. earlier alluded to that the institutions like the Central Hospital, Psychiatric Hospital, would make provision to accommodate them. But in the long run, how do we assist them? Because if somebody is forced to then come to the institution, those that are not ready, and they then come there for a short while, do they get a relapse if they go back, or maybe halfway they decide they are not continuing with the treatment? How do we then, persuade them in so doing?
Okay, I think, when it comes to mental health problems, people do not differentiate between the disorders and the symptoms that the disorders present with, or let me use the term condition, because it's only when everybody will understand what we are referring to. So when we talk about anger, anger is not a mental condition. Anger is a symptom of any of the mental condition. Anger can present in many of the mental condition. Like for instance, let me give the simplest one. Somebody lost their loved one, just a normal grief. And in fact, anger is one of the, when it comes to normal grief, anger is one of the symptom of that. When you see somebody is angry, angry of what has happened, angry of maybe to the cause of the death of the loved one. And the anger is mostly, as I say, is found in mental disorders, and it's just a symptom, or we can say it's a sign of a mental condition. And what causes somebody to become angry is because there are underlying disorders. And anger itself is not considered as a disorder, but a symptom of several mental health conditions. Like somebody who is depressed, they tend to become angry. The person who have got OCD, obsessive compulsive disorder, when things are not going well, the person become angry. Then the person can even have alcohol abuse. Then when they develop that alcohol abuse because of the behavior that changes, they become angry, they become even destructive, destroying, they beat people, they destroy property, they do all those kind of things. We have also seen anger in a child with ADHD. We have seen a child with anger who has got opposition defiant disorder, a child with conduct disorder, a child with intermittent explosive disorder, and even a person with bipolar mood disorder may also present with anger. So what happens is that when they are angry, they become violent, they become aggressive. So as a result, now they can do things which they only regret later when action has already taken place. So therefore, for us to avoid that, because anger is normal, it can be happen to a normal person. I'm sure me and you and the public out there, we have become angry in one point and another. What is important is, do we know how to control our anger? So we need to know how to control our anger so that it does not affect another person or even affect ourselves. Because there are some types of anger where we have got the outwards, the inward, and the passive one. The passive one is where just somebody is just making comments. Look at her, she thinks she whatever, and all those kind of things. And the inward is where now somebody start those self-harming, and that one is more directly to the person that is angry. Then the outwards is those that they are shouting, they are destroying property, they become violent, and they become danger to the people. So anger itself is just one of the symptoms of the mental condition, but not just necessarily found in mental condition, but even when somebody has got physical condition, they also may become angry because they are perhaps blaming the cause of their physical condition or themselves to develop that condition.
Okay. Now, doctor, do we have anger management groups, for example, here in Namibia?
What happened is that, as I said, anger is one of the symptoms that present in a mental condition, as I have mentioned them. What happened is that when somebody comes to us, whether that person just come to outpatient or that person is admitted, And one of the components or the symptom that we found out is anger. So what we normally do, we refer them to our occupational therapists for anger management. But the unfortunate one is that we do not have just individuals coming from home, and they are coming specifically seeking for treatment for their anger problem. But what happens is that we want to encourage that if you find that you have got an anger that you are failing to control, just come to the mental health facility, seek help. You may start either seen by either even a social worker or a psychologist or a doctor or a psychiatrist. Because sometimes you may start where you feel comfortable. Because the public there, they don't feel comfortable going to a psychiatrist because they think they are not crazy, they are not mad. But you can start somewhere where you start, this person will be able to pick up that you might have an underlying mental condition that is causing you to become angry, so that at the end of the day, you will then be referred for anger management. What they normally do with anger management is they will teach you relaxation technique. You need to do some exercise. You need to join some groups. You need to develop a coping mechanism as to be able to control when you feel that you are angry before you regret of your action.
All right. Doctor, sometimes, okay, as you've rightfully put it in the beginning, those that have approached the institutions, how can we convince them that, because what I would like amplified is whether these mental disorders are treatable and that the person's mental health status can totally be, be treated.
Okay, as I say, this mental health is very interesting to us as healthcare providers and to the public out there. As I stated that not every person wants to go to a mental health facility. And again, what we have picked up is that our colleagues who are either at the grassroots level, what I mean at the clinics and health centers, they also lack knowledge when it comes to mental health. And of recently, I even have a patient who was started on treatment, a diagnosis was made, and treatment was started at Oshakati Hospital because this person was hearing voices and was not able to sleep. And after the patient have started the medication, she was able to sleep and the voices disappeared. So then this person visited another health facility and was just explaining how she was feeling and whether she really needed to continue taking the medication. She received a negative information from a healthcare provider to say, no, you don't need to continue taking this medication because this medication will become dangerous into your body. You will only hear that comment from somebody who do not understand. And your question was to say, can somebody with a mental condition be treated and they become cured? What happened is that we are really encouraging that people seek help when it's early. But if then a person comes when it's too late, this person may not be cured of his or her mental condition. What happened is that the people will pick up that somebody has got a mental condition, but because of denial, stigma, and the discrimination, they don't go straight to a health facility to seek help. They may even go to the clinic or to another hospital, which is not a mental health care providing hospital, and they may then find a good Samaritans who will pick up that they have got a mental condition. And they may even rightfully refer for early treatment. But they may refuse because they are in denial. So what they will do, They will first go to traditional healers. They will go for spiritual advice and the prayers. And when they see that things are not happening, that's the time when they are coming. And sometimes it's too late. And the ill advice that is in the community, that is also contributing to the people not seeking help. And sometimes they come late for treatment. What happens is that, as I said, there are many conditions. People only focus that mental conditions are craziness. But there are other conditions that like depression, stress. You hear somebody saying, no, I'm not crazy, I don't have a mental condition, I'm just depressed or I'm just stressed. Now, forgetting that depression, stress, and others that we express, they are also part of mental condition. For the depression, you need to identify what is that causes you to become depressed. So that when you have found what is the cause, then that cause needs to be dealt with. How do we deal with that one? Because when you become depressed, is that your chemicals in your brain become imbalanced. But then the cause is